The process of repair of soft tissue. This presentation will cover how tissues become healed after an injury and the stages that they go through, and also what to do and how to support your clients that are experiencing an injury.
Phases of tissue healing. Tissue healing is all about regeneration and repair, and during this process there are 4 main phases or stages that your patients will need to go through to heal after an injury. And the time frame for these aren't textbook, and it will vary depending on many factors such as how well their tissues heal and the severity of the injury. But it gives you an idea of where your client or patient may be along this spectrum. This slide is just about an overview of the 4 stages or phases, and we'll break each one down individually. But let's have a quick look at the time frames. So the first one is the bleeding phase, so the very initial stage after injury, and that lasts for 4 to 8 hours depending on the client and the injury. The next phase we have is the inflammation phase, which happens around the first 2 to 3 days and can continue up to several weeks after injury. Next is the proliferation stage, which will begin around 24 to 48 hours, right up to 2 to 3 weeks after the injury. And the final stage is a remodeling stage, and this happens around 1 to 2 weeks post-injury and can continue up to 18 months after the initial injury. So let's begin breaking each one down individually. The bleeding phase. So within this phase, there are 2 main stages that the healing process has to go through. So the first one is to stop the bleeding completely, and the second one is to create clotting to keep the injury into that local area. So the first process, which is stopping the bleeding, is hemostasis. And what happens there is that bleeding stops, histamine is released, which creates that swelling, which then allows the platelets to be activated, and then a whole load of enzymes are released to the area to then move into the clotting phase of healing. The platelets are exposed to the collagen within the area, and they create that platelet plug, so the clotting around that area. And what that clotting does, it restricts and obstructs the lymphatic fluid drainage, which then helps the localized injury within that area. And those enzymes work together to really coagulate, to really localize the injury and create that clotting process. The next phase is the inflammation phase. Now, just a note that inflammation is completely normal and it's a necessary process to help with tissue healing. So it's important that we have that within our healing processes. So inflammation is not bad. And what that inflammation does is it initiates that healing process. It keeps that injury localized and contained, and it will gradually resolve itself within 2 to 3 weeks. But it is a normal process that has to happen. So within the inflammation phase, we have macrophages, which are white blood cells, and they arrive in the area and they mop up and remove any debris and bacteria from the injury site. Think of them like Pac-Man, picking up all the bits along the way. So they're removing any extra debris and bacteria from that injury. And what they also do is they release growth factors and cytokines, which are then involved in the proliferation phase. And what happens is when there's less oxygen to the area, macrophages are stimulated to create a process to help increase local blood flow and circulation to the area. The proliferation phase. So this process is all about restoring tissue with laying down of brand new tissue. And it goes through 2 stages during this process. The first one is fibroplasia or fibroplasia. And this is where the fibroblasts lay down new type 3 collagen. So fibroblasts are connective tissue cells and create new collagen. So they create type 3 after an injury. And we'll talk about collagen in a few slides' time, but just to mention that type 3 collagen is a lot weaker and less flexible than the original tissue. But it's the first process to restoring that tissue. The second stage in the proliferation phase is angiogenesis, and that is about creating new blood cells and new blood vessels. So in this area, the capillaries around the injured site start to bud and they grow towards the actual injury itself. And then this then re-establishes blood flow to the area, bringing important nutrients to that injury site. And one of those important nutrients to consider is oxygen. So we need oxygen to help with the healing process. So someone is a poor wound healer if they have a poor diet, or as an example, they're a smoker, then this process will be restricted. And the next phase is the remodeling phase. And this phase is all about remodeling the newly laid down connective tissue into mature scar tissue. So the type 3 collagen, so the weaker collagen that's initially laid down, is reabsorbed by the enzyme collagenase, which then turns into type 1 collagen, which has a lot more tensile strength. Type 3 collagen is also really disorganized, so this process helps reorganize the type 3 collagen into type 1, and then that type 1 collagen is orientated to the lines of local stresses or mechanical stresses, depending on how that person moves or doesn't move. We're going to talk about the local lines of stresses alongside collagen. So the next slide we're going to come into is all about what collagen is and why we need it in our tissues.
What is inflammation? Inflammation is a protective mechanism to help the body repair and recover after an injury. It's important that we have inflammation to help us with that recovery and repair process, and without it, injuries and wounds would never heal. There are two types of inflammation. The first one is acute, which is a short duration, which is what you'd often see after an injury, and you'll see those cardinal signs of inflammation appear. The second is chronic, which spans or can span over days and years, and it's settled. There's often no signs or really subtle signs of inflammation. And illnesses such as long-term ulcers and colitis, they all form under that chronic inflammation category. If you think that your client may be experiencing some chronic inflammation in terms of illnesses such as like colitis, then they need to get some medical attention. This is not something that we can help with in terms of sports massage.
The main signs of inflammation are pain, heat, redness, swelling, and loss of function. You may not see all of them with your client, but there are signs to look out for if you have a client that is presenting with a possible soft tissue injury or dysfunction. Use your palpation skills and your observation skills to help confirm these signs of inflammation.
Various factors will influence the speed and effectiveness of any soft tissue repair process. These include the types of tissue, such as avascular tissues, which are tissues with a lower amount of blood supply, as an example, ligaments and tendons, and these tissues will take longer to repair than those with a greater blood supply, for example, muscles. The next is the severity of the injury. Grade 3 injuries will take a lot longer to repair than grades 2 and 1 injuries. So the more severe the injury, the longer the repair process will take. Next is age. The repair process for older clients will generally take longer to complete than for younger clients. Medication. Although anti-inflammatories may help relieve the symptoms, inflammation is vital for the repair process of soft tissue. This means that taking drugs such as non-steroidal anti-inflammatories, so NSAIDs, may actually slow down the repair process. And lastly, nutrition. An adequate supply of nutritionally rich food containing proteins is vital for the repair of soft tissue. So nutrition is a really important factor to help support the repair process, which we talk about in the nutrition module.
Does massage cause inflammation? Massage may impact and increase inflammation due to the nature of some of the techniques that elicit a high level of tissue damage, which then has to go and create the healing response. And that's what we're trying to avoid. We're trying to avoid creating that tissue damage. Some studies have shown that massage may help with inflammation, but the study wasn't large enough to prove. As a sports massage therapist and you're working with your clients, if your client is experiencing inflammation and you aren't sure why, or there's some injury sites and they're having some inflammation, then that's when you need to refer on to another clinician to get some further help. The RICE and PLEASE acronyms. RICE was created in the 1970s as a treatment process to help with the early stages of soft tissue injury from anything such as a ligament sprain or a muscle strain. So it starts with rest, which is quite self-explanatory, and that is complete rest, so no loading, no weight bearing of that joint whatsoever. Next is ice. And in ice, and the amount of times that you ice for the length of time that you ice is variable in certain studies. Most studies say that it should be for about 48 hours after the initial injury. You want to ice the area for 5 to 10 minutes depending on the area of the body. Let it warm back up to normal body temperature and then repeat. And that 48 hours has been seen to have an analgesic effect also, which is helpful for pain relief. The next is compression. Now, this could be with a bandage or a compression sock, and it's really just about helping the lymphatic system deal with the extra swelling from the injury. And then finally is elevation, which again is helping and supporting the lymphatic system to help reduce swelling and inflammation in the area. But over the last few years, more research has come out that actually we should be loading the joint and the tissue in question optimally rather than having complete rest. And that mechanical loading is more likely to build strength sooner back into that injured tissue. So it's changed to police. So police starts with protection, and this may not be necessary for all injuries. Protection, if you have a severe, so maybe a grade 3 ligament sprain, you may need to be on crutches. So protection would be the crutches, but it varies on the type of soft tissue injury that is occurring. The next is optimal loading, which is the O and the L. And this can mean active range of movements or passive range of movements, building up to weight-bearing activities. And again, it really depends on the severity of the injury. And the last three are the same as RICE, which is the ice, compression, and elevation. So the rule of thumb now and the thought process is actually we need to get the soft tissue functioning as well as we can as soon as possible, which is why police was created.
The chronic stage. This is where you will find most of your clients to be. They may have had an injury for a few weeks before they come and see you. They may have had pain for quite a long period of time before they come and see you. So this is where most of our work as level 3 sports massage therapists will often take place. And the goal is to focus on those pain-free movements and activities. In terms of exercise, it's about restoring mobility, strength and proprioception, which you talk about on weekend 4, and education around how people feel pain, which is what we talk about on weekend 5. So we focus on the tissue recovery work with massage, so calming down the nervous system, and then building strength and mobility on top of that, and also having conversations around how and why people experience pain. Do no harm is a great acronym to consider when discussing acute injuries with your clients within the first 72 hours. You want to focus on and chat with your client about avoiding these 4 key areas. The first one is heat to the area of the injury. The second one is any alcohol. The third is re-injury, and that's your client continuing to exercise if they are into an event, or carrying on with what they were doing after an event has occurred, or repeating what they've been doing that's caused the injury in the first place. And the last one is massage, so avoid any massage to the area of the injury. We love this acronym, which is posted in the British Medical Journal as an alternative and up-to-date way of managing clients through the acute and into the subacute phase of injury. PEACE is the first acronym, which focuses on that acute stage of injuries, the very early days. The first one is protection, so that's about avoiding anything that increases pain. Aiming to elevate the injured area higher than the heart as often as possible, where possible. Avoiding any anti-inflammatories, which could be any medications or ice. Compress the area with elastic bandaging or taping to reduce any extra swelling. And education, so discussing with your client what they can do, discussing them about the process of tissue recovery and inflammation, and also educating them about where they can seek professional help. The next section is love, which is focusing on the subacute and beyond phases. L is for load, which is a gradual return to exercise. Next is O, which is optimism, and that is focusing on confidence, staying positive for that injury recovery process, and just being aware of how long things may take and having small goals in place to help the client work towards those, which helps improve the optimism. Next is vascularization. So choosing pain-free cardiovascular exercises will help increase that blood flow to the area of injury. And then lastly, exercise to help build mobility, strength, and improve proprioception, which is all part of the recovery process. Now, as a sports massage therapist, we can't always focus on all of these ones, especially if you're working with non-injured tissue. But it's really important to have a good awareness of this, to be able to support your client with the right information, but also then to help them find a medical professional if they need one to help them through this process.
Stages of rehabilitation and massage. These are the 4 stages of rehabilitation that a client will go through if they have experienced any type of soft tissue injury. In terms of sports massage therapy, we are unable to help the client with the acute injured tissue. But what we can do is work with clinicians and build that relationship and help the client on other areas of the body while the clinician is helping with the injured tissue and the repairing of the injured tissue. So the first phase is the acute phase. This is where the inflammation stage of wound healing is occurring. There's going to be lots of inflammation, so you may see some of those signs such as rubor and calor. This is where we can recommend the police acronym. So protect the area, optimally load, ice, compress and elevate. In terms of massage therapy, we can massage away from the injury site and we can massage on other areas of the body. As an example, if your client has damaged their ankle ligaments and it's a grade 2 ligament sprain, they might be on crutches. So with those crutches, there's going to be some shoulder tension, upper body tension in the shoulders, arms, bicep, forearm areas that we can work on to help reduce that because the client may be experiencing stiffness or tightness in those areas. You can also work on the other leg, as the other leg's going to be doing a lot more support work. The next stage is the subacute stage, and this goes anywhere between 48 hours up to 6 weeks. And it's the proliferation stage of wound healing where the tissues are starting to regenerate. The client may be able to do some pain-free active and passive movements, but again, that'll be guided by their clinician. In terms of massage therapy, we can continue to massage on other areas of the body where it needs it. The next stage is late stage remodeling, and this can go from anywhere from 6 weeks up to 3 months. And the tissue is starting to heal now, so we as massage therapists can start to massage near the injury site depending on the type of injury and the healing process. If you aren't sure, always check in with your clinician first. And in terms of exercise and movement, the client may be able to do more exercise now. So this is where we work with another professional for some exercise prescription unless you're already exercise prescription qualified. And the last stage is a chronic phase. And this is 3 months and it's ongoing repair and remodeling. The sports massage techniques are relevant for this client now, so we can integrate techniques such as soft tissue release and MET and maybe some frictions. They will need to keep building on that strength after the injury. So again, you want to be working closely with a fitness professional to help prescribe the correct exercises for them. And finally, just some of the references that we've discussed in this online learning.